what am I here to talk about today? So I wanted to give you sort of like a pitch of what we're doing, but also give you a bit of insight into the behind the scenes of what we're actually doing. So this will sort of be a useful insight into what it's been for me to build Suvera, which is my first ever startup. And I can say for sure that I've caught the startup bug, and this probably won't be my last either. So today, I just wanted to say, so what we're doing is Suvera. It is a mobile application to help people easily manage their medications. So as James said, as with all startups, you always start off with what is the problem. So for us as medical students, we realize that the problem is that managing medications is extremely difficult. Chronic medications, the statistics are absolutely shocking. 50% of medications are not taken as prescribed. 30 million people in the UK are affected, spend over £500 million a year. We all know that it's a massive problem, and lots of people are trying to solve it. But the difficulty is that it's such a multifaceted problem. We realise that it's not a one-size-fits-all approach. It's going to take a different way of thinking. And I think we're at such an exciting time now that everyone's using mobile phones. We can use remote technology. And so for us as sort of young medical students, we thought this is an exciting time for us to try and make an impact. And that's what we set about doing. So this is sort of our story, a very, very sort of typical cliche startup page where you have like the pencil drawings and then the wireframes, and that's where we are at now. Where we started off at a pre-accelerator program, which was run by students. And the reason why I really recommend accelerator programs is that, first of all, you can build your team, you can meet like-minded people, but you also need accountability, which I think has been the hardest thing about doing a startup, is that you constantly face new problems, and we're always trying to make sure that we're always pressing, finding new solutions to these challenges. But this is sort of the progression of our onboarding screen. And as you can see, this has been iteration after iteration to make sure that we create the best design for patients, which is what we're essentially trying to do. So what is the Suvera experience? What makes us different? So we want to create a tool which is easy for people to manage their medications from beginning to end. And we also want to remove the burden of managing medications for GPs. So at the moment, when I sit in GP practices, lots of these appointments are just standard medication reviews where the patient and the doctor will just talk about whether or not the medications are working as prescribed. And that takes up a lot of the GP's time when these appointments could be better used. So we want to take that and make it more remote, and then therefore we can communicate this via an app. So what is it? What makes us different? So there's 3 points of differentiation which I'll talk about. The first one is that we're personalized. Every Suvera experience will be different. Mine will look different to yours. We realize that there are two extremes. So we have on the left a busy city worker, someone who's always commuting, someone who's always traveling, different time zones, and they'll find it very difficult to stay on track and get scheduled reminders. The second end of the extreme is people who might be elderly, live at home, need carers, and therefore they will need a different approach to help them remind them of medication. So we're taking two different approaches, a remote one and a home-based one. So as we can see, there's time zone support, easy customization, and altering how these notifications are delivered. And sort of giving you a bit of insight how we came about this is that, you know, this is a very tech-based audience, but we went with a very, very simple clipboard and pen approach, went out into the London hospitals and just asked hundreds of patients about their experiences of medications, and we realized that there's just a huge spectrum. So one of our first things, which was the most valuable, was really understand the patient, really understand the group that you're designing a tool for. So that's how we came across with these two different groups. So that was the personal aspect. But what makes us different is that we're also well supported. So we want to make it very, very clear that we want to empower patients, but also give them an opportunity to have real-time support with clinicians when they need it most. So instead of having to wait until the next appointment to ask a question, they can ask it immediately. So what we have is we have physician and pharmacist verified regimes. So what does that mean? So it means that once you come out of a GP appointment and you have your diagnosis and you get told what medication you need to manage, when they open up their Suvera app, they will already have an onboarded medication and the GP is sent directly to their phone. Therefore, they know it's completely verified and they know it's accurate. They can have full control about how they want to be reminded. Once they do that, they send it back to the healthcare provider and they will verify that the regimen they have decided to take is indeed correct. And that gives them the ability to be empowered and feel in control of their own medications, but also know that there's a healthcare professional always watching over them. And so with these, these communication channels will be a really useful insight, because at the moment there is a massive gap between medications being dispensed and people actually taking the medications. There's no one tool at the moment which really understands that behavior. So that's what we're trying to tackle. And I understand today this is a data science audience, so I wanted to focus on this point a bit more. So we wanted to really have insights and be able to have user feedback and really give the opportunity for people to improve on their adherence, because that's really the main goal of things. So with the notifications, when people receive them, we will understand when they take them, why they don't take them, if they miss them, what time they miss them. So that's all the quantitative data that we collect. But also the qualitative data, we understand that it's not just a case of I'm too busy, I'm not taking my medications. It's actually a lot more complex than that. Some people don't take it because they have symptoms that they don't like. Some people don't take the medications because they don't really understand why they're taking the medication. So we are taking a holistic approach from just quantitative and qualitative data. And with that, we want to give meaningful insight. We want to give weekly summary reports via an email, just to say, look, here's how you're doing, here's how many medications you missed, and here's the target that we want you to reach, to really give them that feedback. And I guess this is where the future of where we want to go with this, because at the moment we're still at the early stages, but with the more data we collect, the more we can really predict the certain patient groups that will be more difficult to manage. And with the more difficult people, we can give them more incentivized support. We can start their communication channels early and really give them that added benefit. And we can also do things like predicting whether or not a certain medication will work for someone if we have enough evidence to show that actually these specific patient groups will develop symptoms at certain times. So why don't we shift them to a different medication earlier? So it's all about collecting this data and then feeding it back into the system. And the useful thing about this as well is that the doctors will have a dashboard and essentially be able to know what the patients are doing and understand the behavior behind it. So that's a summary. The overview is that we want to have it as an end-to-end tool to have continuous support management and to really have data-driven insights to be able to help people improve their medication adherence rates. So just to give you a bit of insight into our business model as well, this is something that we thought about a lot. And one of the key ones, of course, is the insight that we get from the data. Like I mentioned, there's not really a tool at the moment which captures what patients are doing with the medications and what their behavior is around it. And a lot of pharmaceutical companies want to channel their research, they want to develop trials, and we want to be able to help them access the correct patients and give them the insight into how they're managing their medications. The second tool, or sorry, I should say the channel that we're trying to investigate, is something that we're still testing at the moment, but that's with individual CCG groups. So these are groups that commission healthcare services, and what they really want to know is, can you save us money? And so we need to demonstrate evidence in order to show that. And sort of as James mentioned earlier, the reason why it's so difficult in healthcare is because you have to show evidence, which I think is actually a really important point as well, because we're dealing with people's lives. So that's the second channel we want to investigate. But this is our team. So Ivan and I, so we came up with this idea. We wanted to tackle this problem. And over time, we realized that our skill sets needed to be enhanced. So we realized that we needed a designer on board. This is definitely a challenge, which is both technical and design focused, because we're designing a tool for ill patients who might be visually impaired, who might be elderly. So we realized that it has to be super simple, super clean, and really fun to use as well. So that's the team that we've developed over time, and it hasn't come on the first day. We really had to be honest with ourselves as to where we were lacking our skill sets and find the right people for it. And so just to briefly touch on the next couple of months of where we want to go for this, we're developing the app, we've got the MVP ready, and we want to user test it. And we're also developing alongside that the Alexa skill, so that patients can onboard the medications and also be reminded of that as well, which we've been tackling, which has been really fun to do. So the vision is to have it as a cross-platform, end-to-end experience, end-to-end from both smartphones all the way to home tech products, but also end-to-end from the sense that from the end of your GP appointment right to your next GP appointment, you always have that continuous support. And so just to sort of finalise and to finish on sort of the challenges we faced in healthcare as an overview, we found that the product needs to be 90% there before you can test it for clear reasons. You don't want to test a faulty product with patients. I mean, we don't want to mess up with epileptic patients and their medications and tell them at the wrong time. That wouldn't be too good for our reputation or their lives, for that matter. Health professionals and patients need to be on board from day one. So the reason why we added that is that being amongst the startup communities, we found that a lot of people are trying to solve problems that aren't actually there. And we decided that we actually wanted to go from the reverse and really find out the patient's issues first. And so that's why we added this one in, because essentially if we're going to get anywhere with this, we're going to need the patients and the healthcare professionals on board. Thirdly, like I mentioned, design. We realized it was very important that we create a simple and useful tool. And also fourthly was the strategy for validation and user acquisition. Again, because it's in healthcare, you need to have really clear clinical trials. And that's well researched and has a good format. But that is a summary of where we've come, what we've done, and hopefully with the benefit of the help and I know that James and Alex will provide us the right framework. Hopefully Suvera will help people's lives. Thank you.